Hello everyone, welcome back to our Fire Nursing Tutorial YouTube channel. We'll discuss in this class that is phototherapy. Who all have visited first time on this channel, please do subscribe. We'll see what is phototherapy. Phototherapy is the treatment of neonatal jaundice using blue light to convert unconjugated bilirubin in the skin into water soluble that baby can excrete through urine and stool. Here phototherapy is the treatment. It is given to the neonatal jaundice. It is given to the neonates for the jaundice. And then here they are going to use a blue light that's going to convert unconjugated bilirubin in the skin into water soluble that baby can excrete it out. This is nothing but a phototherapy. Next we'll see the types of phototherapy. Here first one is conventional phototherapy, that is fluorescent or LED blue lamps are going to use in this. And then second type is fiber optic phototherapy. Here Billy blanket and then that is portable device. Fiber optic cables transport this light from the elementer to a special pad. Next we'll see the mechanism of action of this one, phototherapy. Here light converts unconjugated bilirubin into excretable forms, that is structural isomers and then photoisomers and then oxidation products. Next we'll see the procedure. Here first procedure for phototherapy is undress the baby, only diaper has to be there. And then eyes and genital area has to be covered. And then light source wavelength, that is 420 to 490 nm. And then distance between lamp and baby is 30 to 45 cm. Maximum skin exposure should be there. And then baby should be turned every 2 to 3 hours. This is the procedure for phototherapy. And then monitor temperature every 2 hours. And then provide additional IV fluids to prevent dehydration. Monitor urine or stool output. And then serum bilirubin levels must check at least every 12 hours. Next we'll see the indications of phototherapy. Here unconjugated hyperbilirubinemia, this is the indication when to give phototherapy. And then to prevent kernicterus. And then hemolytic disease of newborn, that is Rh-ABO incompatibility. These are the indications of phototherapy here. And then side effects we can see. Commonly we can see loose stools, dehydration, rashes, hypothermia and then hypothermia. And then less commonly we can see bronze baby syndrome, that is dark gray discoloration we can see. And then red is retinal damage if eye is not covered. And then hypocalcemia we can see. These are the side effects. Next we will see the advantages and limitations of phototherapy. Advantage is that safe, non-invasive, effective in preventing kernicterus. And then limitations, not useful in conjugated hyperbilirubinemia. And then may require exchange transfusion if bilirubin rises despite therapy. These are the advantages and limitations of phototherapy. Please like, share and subscribe to my YouTube channel for more informative content.